Hi, I'm Alex Carpenter, and I am going to perform a piggyback today. I just received orders from Mr. Jackson for Recepin, 1 gram of it, to be given IV just once today. And what I do have is available is 500 milligrams per ml. So in order to get 1 gram, I'm going to have to do calculations, which is 1,000 over 500 times 1, which equals 2 mLs. Okay, Recepin, what it is an antibiotic. It's to treat and fight bacteria. This recommended dose is 1 to 2 grams once daily, and side effects are GI upset, but more seriously, you will get an anaphylactic or anaphylaxis if they are allergic to penicillin, milk proteins, or pectin. So I have to check with my patient and my labs and everything to make sure that they are not, which they're not. And also I have to administer the IVs over 30 minutes. So I'm going to go ahead and check my infusion time, which is 50 mLs, because I am using a 50 ml bag right here, and it says that the drop factor is 10. So, and it's going to be administered over 30 minutes. So 50 mLs over 30 times 10, which equals 17 drops per minute. Okay, I'm going to go ahead and gather everything up and just make sure that my bottles and everything is in date. Everything's intact, sealed, and there is no soilage. Okay, I'm going to go ahead and wash my hands and glove. Okay, I'm going to go ahead and draw up my 1 gram of Recepin. I'm going to use aseptic technique and clean the top of my bottle. This is already in the packaging. I'm opening it up and putting it on. This is my syringe. Okay, and I'm going to draw up 2 milliliters of air. Okay, I'm going to inject that in, and I'm going to withdraw 2 mLs of Recepin, which will equal my 1 gram. I'm going to go ahead and get my air bubbles out. Recap scoop method for right now. I'm going to go ahead and get my piggyback, my mini bag, and it's 50 mLs. I'm going to go ahead and clean my port here. I'm going to inject my Recepin. Okay, this is going straight into the sharps. I'm not scooping and doing that, but it's going straight in there. Going to mix my medication. Everything's good. And I am going to label my bag with the patient's name, date of birth, my initials, date and time, the drug that's in there, how much of it is in there, and my drop factor, and just the time that I plan on starting it. So I might just wait to see what time I'm going to get it actually in there. Okay, and now I am ready to take all my things. I'm also going to take my label for my tubing, my piggyback tubing, so I can label it with the date and time that it actually starts getting infused and my initials. Okay, I'm going to take off my gloves, wash my hands, go into the room. Okay, knock, knock, knock. Hi, Mr. Jackson. My name is Alex. I have physician's orders right here saying that you need to have Recepin administered by piggyback. It means I'm going to hang another bag along with your primary IV bag here. How are you today? You're doing good? Okay, good. I'm going to wash my hands and put my gloves on. Can you tell me what your name and date of birth is? Okay. And your, do Do you have any allergies? Do you have any allergies specifically to penicillin or milk? Okay, good. I'm going to inspect the INT sites and check for inflammation or redness or any phlebitis. But everything looks good, and everything seems to be flowing. Yeah, so my primary tubing is good. Okay, so now I am going to hang my piggyback, or actually drop my primary here. My primary is full. Doesn't look full right now, but it is full. Okay. Okay. And then I am going to hang my piggyback, or actually spike my piggyback. Okay. And make sure it's still clamped. With the label already on it. I'm going to prime my tubing here halfway. Okay, it's there. Okay. I'm going to prime the tubing. Take this off. Clamp it. Okay, no air bubbles. I'm good. Okay, and now I'm going to clamp my primary. Okay, we're good. Okay, I'm going to clamp my INT. Okay. Clamp my INT. I'm going to wipe my ports on my primary tubing. And I'm going to go ahead and do it on my piggyback tubing just in case. I'm going to go ahead and hook it up. Okay. My primary tubing is clamped. And I'm going to unclamp my INT and unclamp my piggyback. And then I'm also going to make sure that I am at 17 drops per minute. And it looks good. Everything looks good. How are you doing? You doing okay? Okay, I'm going to come back in 30 minutes. This should be done. And I'm going to take you off of it and just check on you. But in the meantime, if there's anything that you need, or if you're in pain or anything, your call bell is right next to you. Make sure that they don't need to go to the bathroom or anything like that, the 4 Ps. Okay, we're good deal. I'm going to take off my gloves, wash my hands, document the time that I put the medication up, the piggyback up, the patient's name, date of birth, my initials, of course, like I said, the medication date, dose, route, and everything like that, and how well they tolerated, and make sure to also document that my INT site was free of any kind of complications, or if there was complications, put that on there. Okay? Okay, so now 30 minutes has passed. I'm going to go ahead and come in. Knock, knock, knock. Hi, Mr. Jackson. It looks like you're done there. Let me go ahead and take that off for you and just get the your other IV going again, okay? I'm going to wash my hands, glove, and now I am going to take off. I don't need to clamp that, but I'm going to take this off, restart my IV back again, take this off, put it back to where it was, get my drop rate the way it was before, where it needs to be, which I already checked my papers there, and it said that they needed to be at 17 drops per minute. So we got that taken care of. Okay, how are you doing? Okay, check my INT site again. Everything looks good. No inflammation, no signs of phlebitis. Any pain? No? Okay. Okay, so I'm going to take off my gloves, wash my hands, and then go ahead and document again, the patient's name, date of birth, medication dose, route, frequency, and how they tolerated everything. There wasn't any signs of anaphylaxis or anything like that. They tolerated it well. And then intake, output, and volume, fluid volume.